The word that most succinctly describes the healthcare industry is uncertainty. The regulatory climate moves quickly and can change directions rapidly, leaving little time for providers and their patients to adjust. Providers don't know if their patients will be able or willing to pay the bills after a procedure is performed. And even practicing medicine itself is an exercise in uncertainty, from diagnosing an illness to delivering a prediction to a patient. But one thing in healthcare is certain: significant percentages of claims will be denied by insurance companies. Industry benchmarks state that roughly 5 to 10% of physicians' or hospitals' claims will be denied by insurance. However, a true national average is nearly impossible to pinpoint. Indeed, most CEOs, CFOs, and revenue cycle directors are not able to accurately report their denial rates and lack detailed data to support those rates. Why is it so hard to come up with this number? Shouldn't it be easy? What most studies, vendors, and software companies fail to take into account is that the definition of a denial is subjective. This definition differs by physician, biller, and institution. It also varies by payer and procedure. If something is denied, but expected or per contract, is it truly a denial? If a claim is paid to a certain extent, but not to the full allowable amount, should it be considered a denial? Will certain procedure codes always be denied? Do they need to be billed anyways? How can all of this be tracked and measured? Most importantly, how can physicians and institutions collect the money that they have earned? Introducing AppealsPlus. AppealsPlus is a cloud-based software that combs through your electronics remittance files according to your definition of a denial. AppealsPlus not only identifies denials, but displays the information in easy-to-understand reports and graphs. Your billers will be assigned the identifiable denials according to your workflow, rather than how a vendor thinks you should work. Finally, gain insight into what your billers are doing, which denials are the most costly, and how much money you've recovered. Stop wasting hours trying to compile reports from multiple systems and get your weekends back. Healthcare is uncertain enough. Don't let your denial rates be another mystery. AppealsPlus. Move beyond manual.